All right, so we're diving into men's prostate health today.
Oh, yeah. This is going to be interesting.
And get this, it's a way bigger deal than you might think. We're talking beyond just personal well-being. This interview we found with Dr. Rashid Abbasi.
He's really passionate about this stuff.
Yeah, and it really shows. It's called Men's Prostate Health and the Impact on Society.
And it's an eye-opener for sure.
You take time.
Right.
So what I thought was really fascinating is how Dr. Abbasi connects prostate health to cultural norms and even like economic theories.
It's wild.
Yeah.
But there's some real gold in this interview, so stick with us.
Absolutely. Okay, so let's unpack this thing. Starting with, I think, probably the biggest attention grabber, that 21 ejaculations a month thing.
Oh, yeah. He just drops out like it's straight up science.
Yeah, like it's a fact.
Yeah.
What do you even make of that?
Well, it definitely makes you go, hold on a sec, really.
Good.
But his reasoning is that frequent ejaculation can reduce swelling and, keep things flowing, which is super important for prostate health. And he ties that to the fact that a lot of men today aren't exactly living the most active lifestyles,
Yeah.
Hours at a desk, not a recipe for vitality.
True. He even mentions a study where men who added just 30 minutes of walking a day
Split between morning and night.
saw a 45% reduction in prostate issues. Wait, there's more.
Yeah.
More morning erections.
Added incentive to get moving.
Right.
But what I think is really interesting there
Yeah.
is the link he's making between our modern lifestyle and prostate health.
Yeah.
It's not just, what's happening down there, but our overall activity level and how that might be impacting things.
For sure. And then he goes on to link prostate health to, wait for it, polygamy.
You're kidding.
No. He actually argues that polygamy is good for men's prostate health.
Wow.
Citing lower rates of issues in cultures where it's practiced. Things get a little complicated here.
Yeah. This claim definitely gets into some sensitive territory.
Yeah.
Touching on cultural and religious beliefs. But his argument is that men are basically biologically wired for polygamy, bringing in pheromones and their role in attraction and, sexual function.
He even shares that anecdote about men experiencing ED with their wives, but not with other women.
Yeah.
And attributes it to this kind of novelty factor.
Like reigniting that pheromone connection.
Yeah. Crazy.
It is. But let's be super clear here. We are not endorsing polygamy in any way.
100%.
Our goal is to lay out what's in the interview, not tell you what to believe.
Exactly. We're all about exploring, even if it's outside the box. And speaking of outside the box, Dr. Abbasi drops this whole outsourcing concept.
Right.
I don't even know where to begin with this one.
He uses it to suggest that alternatives to strict monogamy could benefit men's health, AE, have a positive impact on the economy.
Wait, what?
I know. Hang with me.
Okay, I'm listening. But happier men equals better economy. How does that even work?
Well, his logic is that when men are happier and healthier, they're more productive workers, which in theory leads to a stronger economy. He even brings up this example from Maryland where they were trying to lower the divorce rate. And the initiatives involved counseling that addressed, let's just say, intimacy issues.
So they were encouraging couples to spice things up.
It is. And the results were actually pretty interesting. Divorce rate dropped, productivity increased.
Huh. Interesting.
While it might seem like a stretch, there is some evidence that maybe he's onto something.
Okay. So we've covered some wild ideas, but let's shift to something a little more serious. The stigma around men's health. Dr. Abbasi talks about how a lot of men are just hesitant to get help for prostate issues.
Yeah.
Which can obviously have some bad consequences.
It's almost like this silent epidemic. Men suffer in silence, afraid to be judged or seen as weak.
Yeah, it's heartbreaking. He shares the story about men who didn't want to sign at his clinic that said men's clinic.
Wow.
Because they were worried what people would think.
Really?
Yeah.
Wow.
It's sad that men would rather ignore a problem than seek help.
It's like they're trapped in this cycle of silence and shame.
And, it really ties into how we define masculinity.
Yeah.
Where men feel like they can't show weakness.
Right. Which can be so damaging.
Absolutely. And get this, there was this study that found 79% of men would rather not treat prostate cancer.
No way.
If it meant risking ED, even if it meant their life was on the line.
Wow.
So
that's crazy.
It's really tied to their sense of self-worth.
It shows how much we need to talk about this more openly, both with doctors and partners.
Yeah, for sure.
Dr. Abbasi even suggests that couples go to prostate health appointments together.
Ooh, I love it.
To break down those barriers.
That's a great idea. And there's another layer to this. Access to healthcare isn't the same everywhere.
Hmm.
Dr. Abasi talks about how some men in Nigeria choose traditional remedies for prostate issues over modern medicine.
Oh, that's interesting.
Yeah, and he breaks down a few reasons.
What are they?
Lack of awareness about modern treatments. The cost of medical tests can be a big barrier. And there's a cultural trust in traditional medicine that's been passed down. So it's this mix of awareness, affordability, and tradition.
It's complex, for sure.
And speaking of assumptions, Dr. Abasi challenges the idea that prostate problems are just for older men.
Oh, yeah.
He points out that younger guys are increasingly affected by this. Why do you think that is? What's changed?
Well, he blames it on our lifestyles. Processed foods, lack of physical activity compared to previous generations.
I know. He's got a point. Our grandparents walked everywhere. We drive.
Right. Those little choices add up.
And it's not just prostate health. This goes for heart disease, diabetes, mental health.
It's a wake-up call.
For sure.
To move more and stress less.
Yeah. And then he talks about the impact of prostate cancer on the workplace.
Right.
He thinks companies should be legally required to support employees recovering from prostate surgery.
He's really pushing for change there.
He is. It's about recognizing that it doesn't just affect the individual, but their families and communities and the workplace.
A ripple effect.
Right. It's a holistic approach to well-being.
Exactly. And that's a key takeaway. Dr. Abasi wants us to see how men's health is connected to everything.
It's not just a personal issue.
It's societal. Welcome back.
You know, one of the things that really hit me from the first part was that statistic about men rather ridding their lives than dealing with potential ED.
Yeah. It really shows you how much our sense of self is tied to our sexual health.
For sure. It's almost like Dr. Abasi is trying to challenge those traditional ideas about masculinity.
Like pushing for a more vulnerable and open approach.
Right. And he even suggests that couples go to those prostate appointments together.
I know. That's pretty revolutionary.
Especially with all the stigma around these issues.
It is, and it shows the power of, partnership and communication.
Right. These health concerns don't just impact the guy.
They impact the relationship, too.
Exactly.
Yeah.
And he also talks about those healthcare choices.
Yeah.
Especially in a place like Nigeria, where traditional medicine is so important. It's this tough balance between respecting traditions and making sure people have the best treatment.
So how do we bridge that gap, then? Between traditional and modern medicine?
Right.
How do we make sure people have good information and safe treatments while still honoring their culture?
That's the question. And it's not just about the prostate. This goes for a whole bunch of health issues where culture and modern medicine clash.
Absolutely. It's about finding ways to blend those approaches so everyone benefits. And actually, Dr. Abasi brings up another point.
Okay.
The cost of those medical tests in Nigeria, it prevents a lot of men from getting help. He thinks basic prostate screenings should be covered by insurance and the government.
So he's all about early detection, being proactive.
It could save money and lives.
I have to admit, though, that 21 ejaculations a month thing really caught my attention.
That's a memorable number.
Is there any actual science behind that?
Well, he's pretty adamant about it.
Right.
But more research is needed to say for sure.
But his thinking is interesting, though.
What is it?
He says ejaculation helps clear out the prostate, prevents that buildup of fluids that can cause problems.
Okay. It's an interesting theory.
Right.
It brings us back to understanding our bodies and what keeps us healthy.
For sure. And he also connects modern lifestyles to more prostate issues in younger men.
Yeah.
He makes a good point. Think about it. Our grandparents were so much more active.
They walked everywhere.
Right. We drive everywhere.
It's a big difference.
Makes you think.
Yeah. Our bodies are definitely feeling the effects.
Not just for prostates. This is for everything. Heart disease, diabetes, mental health.
We need to move more.
Stress less.
Yeah, for sure.
And he also talks about those workplace issues.
When it comes to prostate cancer?
Yeah. He thinks companies should be legally required to support employees recovering from surgery.
It makes you wonder how we can create better work environments that really support people's health.
Mental and physical.
Absolutely. Our health isn't just personal.
It affects everyone.
Right? We all benefit from a healthier workplace. And get this, he actually suggests that companies should give guys breaks to engage in sexual activity.
Whoa, now that's a policy I've never heard of.
It's a bold idea.
Yeah.
I'm not sure how realistic it is,
right?
But it shows that we need to recognize and respect sexual health in the workplace.
It's part of our overall well-being.
Ignore it.
And he also brings up infidelity.
Oh, boy.
And its potential connection to prostate health.
Okay. This is a tough one.
He argues that men with multiple partners are less likely to have issues.
Again, we are not endorsing cheating here.
Absolutely not.
But we're trying to understand his point of view.
Right. He's not saying go cheat. He's just making an observation.
He's trying to understand why.
Right. And he brings in pheromones again.
That seems to be a theme with him.
Yeah. How they affect attraction and arousal. And he thinks exposure to different pheromones could be beneficial.
It's a theory.
Yeah. Needs more research for sure.
We can't just jump to conclusions.
But he also talks about sexual compatibility between partners.
Right. And how dysfunction can hurt a relationship.
He's big on communication.
Seeking help if you need it.
Even suggests a test drive period before marriage.
Oh, wow.
To make sure things are working.
That's going to start some arguments.
I know, right? But it does highlight how important that compatibility is.
For a healthy relationship.
And he dives into traditional medicine, too.
It's for prostate problems.
Yeah. He knows a lot of men in Nigeria prefer those remedies.
Because of culture or finances.
Right. He wants more research on traditional medicine.
To make sure it's safe and effective.
And he warns about the risks of using it without guidance.
It's about finding that balance again.
Respecting traditions, but promoting good practices.
Right.
Man, this interview has been a lot.
It has. So much information.
Bold claims, controversial stuff.
Makes you think.
Dr. Abbasi really challenges how we see men's health culture relationships.
He's not afraid to push the boundaries.
Which is what we need.
To really move the conversation forward.
He's a passionate advocate.
And his insights are valuable.
But there's still more to unpack.
In the final part.
Yeah, we'll explore those economic implications and his views on polygamy.
Stay with us. It's going to be interesting.
Okay, so we're back. And we're tackling what might be the most controversial part of this whole interview.
Yeah, the link between men's health and the economy.
Dr. Abbasi pretty much says that if you want a strong economy,
you need healthy men.
Exactly. Happier, healthier men equals a more productive workforce. It's definitely a different way of looking at things.
For sure. But he brings up that example from Maryland.
Right, with the divorce rate.
They tried to reduce it by addressing those, intimacy issues in marriages.
Yeah.
And it actually led to increased productivity.
Interesting.
It is. Now, obviously, it's just one example.
Yeah.
And who knows how much one thing impacts something as complicated as the economy.
Right.
But it makes you wonder.
Yeah. Does taking care of men's health actually lead to a stronger economy?
Should governments and businesses be thinking about that?
And then he goes on to use this term outsourcing.
Here we go.
To talk about alternatives to monogamy.
Yeah.
Suggesting it could be good for men's health and the economy. I mean, this is where things get really tricky.
We're wading into some deep waters here, touching on cultural and religious beliefs.
Absolutely. And just to be crystal clear, we are not saying one type of relationship is better than another.
Not at all.
We're just laying out what Dr. Abbasi said.
Exploring his arguments.
Right. Not telling anyone what to believe.
But it does make you think about how our ideas about relationships are changing.
Yeah. And how that all ties into individual health and the well-being of society.
For sure. He also talks about the cost of untreated prostate problems.
Right.
When men suffer in silence.
It can affect their work.
Less productive.
Lose income.
More healthcare costs later on.
It's like a chain reaction.
Impacts families, communities, the whole country.
Makes you realize that prostate health should be a bigger deal.
A public health priority.
Invest in prevention, education, treatment.
It could actually save money in the long run.
Right. And then there's the cultural stuff.
The stigma around men's health.
Dr. Abbasi talks about that pressure on men to be tough.
To hide their problems.
Never show weakness.
And it makes them ignore symptoms.
Wait too long to get help.
Suffer in silence.
He even tells that story about the men who didn't want the men's clinic sign.
Because they were worried about what people would think.
Yeah, it's crazy.
Yeah.
They were more worried about looking weak than getting treatment.
That just shows how much we need to change the conversation around men's health.
To make it okay for them to talk about their problems.
To get the help they need.
And Dr. Abbasi's big on communication, too.
Encouraging couples to be open about these issues.
To support each other.
To work through it together.
Well, this whole interview has been a wild ride.
Bold claims, controversial ideas.
Makes you think.
Dr. Abbasi really wants us to rethink how we see men's health.
Culture, relationships.
Even the economy.
He reminds us that our health is connected.
We're all in this together.
Taking care of each other benefits everyone.
So what are you going to do with this information?
Are you going to prioritize your health?
Encourage the men in your life to do the same.
Will you speak up about these issues?
Push for change.
The power is in your hands.
Take what you've learned and make a difference.
That's what this deep dive is all about.
It's about starting a conversation.
And creating a healthier future for everyone.